Welcome to the Extraordinary Health Podcast from All Seasons Integrative Health with your host, Dr. Paul Beckham. We're here to find the root cause of your health condition and help you to finally feel good again. At All Seasons Integrative Health, we utilize full body chiropractic care and the latest cutting-edge physical medicine therapies, as well as functional medicine to help you live your full potential.
Well, hello and welcome to the Extraordinary Health Podcast. Today is going to be episode 4 of our full body chiropractic care series. And in today's episode, we're going to be going over elite care for peak performance. In today's episode, we're going to go over a comprehensive review of what elite health care is. We're also going to go over the role of elite care in optimizing health and performance. Next, we'll go over specialized treatments and technologies that are utilized, stories from some elite athletes and high-performance individuals. Next, after that, we'll go over an athlete spotlight interview, as well as some scientific evidence supporting elite care's effectiveness. Also, how elite care is customized to each individual's needs and the long-term benefits of elite care. So, let's get into the episode here. Elite care is something where we're literally looking at a comprehensive overview of your body here. Elite care is kind of the pinnacle of the full body chiropractic treatment regimen. We're literally utilizing technology to determine, your functional movement, your biomechanics, even getting into and including some functional medicine metabolic assessments where we can get some blood labs drawn to find out just exactly, what your body needs nutrient-wise too. We also combine that then with some advanced chiropractic techniques and use some cutting-edge therapies to help, heal injuries, because a lot of times people are coming into our office, because they have pain. Some of them it's because, they can't perform certain activities, and it's because of those activities that, they are seeking care in the office here, and, we need to determine with their initial assessments exactly what they have going on so that we can make sure that we build a customized treatment plan to deal with any of those, possible issues, whether it be, inflammation that's going on, weak muscles, joints that are out of alignment, nerves that are getting irritated because your nervous system controls your whole entire body. If we don't get that cleared up, your body's never really going to heal. So the next big thing was also trying to look at a complete, just holistic approach to your body. If that isn't evident in what we've been talking about already here, instead of compartmentalizing it, which is conventional medicine's way of looking at things, and even in a lot of other chiropractic offices, it's compartmentalized. They're going to look at your spine and make sure that your spine's aligned. You get that irritation off your nerves, so you do get that proper communication between your body and your brain, but then that's where it's kind of left. I know I've had training, and I got my CCSP shortly after I got out of school, which is a certified chiropractic sports practitioner, and I even found that to be, again, something where they've compartmentalized things. So look at, if you have knee pain, they're going to look at your knee, but with full body chiropractic care, we're going to look at your full kinetic chain, which starts at your feet. I've recently talked with a doctor about certain practices in the area, and a lot of them, they're looking at treating things like knee pain or shoulder pain. But again, they tend to compartmentalize it down to just that joint, and there might be problems going on around that area that need to be dealt with that are going to get missed, and they're not fully going to get the condition resolve for you. So that's what our full initial assessment, what I would call our holistic health assessment, as far as from a functional physical medicine and rehabilitation standpoint would go, so that we can, again, get down to the root cause of the problem and hopefully get it resolved for you. So, the role of elite care in optimizing health and performance, it is used to enhance athletic performance through the improvement of the biomechanics as well as your nervous system function. So we're trying to get your bones and joints working correctly. We're getting that proper alignment back to them with the proper movement and motion. Like, this is probably the big, blind spot of even traditional medicine as well, because they'll just assume your joints are going to be the way they are. They're not going to change. And we see people in the office all the time, and we're able to get, the proper mechanics back to them, even if they have, sometimes very significant arthritic changes, in the joints. So other than that, I don't want to get out of place here. Getting back to the nervous system, we're always wanting to look at getting that proper connection between your brain and your body. Because if we don't get that connection back, that's where you're going to have problems long term. Your body's going to go right back to kind of favoring things. Your body's always trying to protect itself. And that's what I always trying to communicate with the patients that come in the office. It's pretty obvious when you have an acute injury, you sprain your ankle or something like that, and, you don't put any weight on it. You don't want to stress it. You're probably hopping around on the other leg, just to try and make sure that you're not putting stress on the one that you just sprained. But the problem gets to be when you've maybe had multiple sprains, you've maybe gotten it treated, you've maybe taken some medications to help deal with the inflammation and the pain that's going on, but you never really dealt with the improper mechanics or the dysfunction that's going on. And until you really get that taken care of, you're going to end up having chronic problems. And, a lot of people, could be weeks, could be months, could be years, or even decades down the road where you finally are getting something taken care of and you just didn't realize that, oh my goodness, this actually can be better without having to take medications or even have a surgery done. And some people even might be too late. They've already worn the joint out, but we can make them feel better in the meantime here. We'll let them know if they need to have a surgery or anything like that. But a lot of the patients we have come in the office, there are definitely some alternative treatments that can be done that will help get rid of the pain, get a lot of the function back there. If not, I would say we can get pretty close to full function in most people, definitely over the 85th percentile range, which in most insurance companies would consider normal. So again, if you have something going on, don't wait, to get treated. The sooner you get in, the sooner you can kind of get over it, the sooner you can get the proper mechanics back, then the less chance you have of having long-term wear and tear on things, so that, you're setting yourself up for a surgery down the road. So, big things to kind of look at here, if we want to enhance recovery from injuries, especially if you've been, whether it's intensely training or you're in some competitions, you've literally stressed those joints and ended up having dysfunction occur because you've injured them, you've had some sprains or strains, and again, like I mentioned before, just, making sure that you get it dealt with as soon as possible, and that way we can get you back the normal mechanics, get you back the normal function, and the chances of like osteoarthritis, which is a wear and tear arthritis, goes down significantly. What is the role of elite care in optimizing health and performance? Well, elite care is here to, enhance that by improving the mechanics and getting the nerves attached, or your body and your brain kind of connected together again. We can measure that by the functional movement screening test that we use in the office, which is a markerless motion capture system. So we can measure the proper function, ranges of motion, balance, all those kinds of things. And we can make sure that as you're even going through treatment, that is getting better. We also want to use Elite Care to help, accelerate recovery, from any kind of intense training or competition that you might have. We want to look at preventing injuries and also addressing any kind of imbalances that are there or weaknesses more proactively here. A lot of patients, when they come in, we do some manual muscle testing to find out where people have what I would call inhibited muscles, because what we're really testing for here are what are called your joint mechanoreceptors. And those are basically like the nerve end organs that go to your muscles, your tendons, your ligaments, the joint capsule, the joint synovium. So all that neuromusculoskeletal tissue here. Now, if you have an injury in an area, or you've had an injury in an area, or your brain thinks that you have an injury there, it's going to, those nerve end organs kind of act like a circuit breaker. And when we go to test the muscles there, a lot of people are very surprised that they end up having what they would think being weak muscles. And it's not that they're weak where you need to go to the gym to strengthen them. A lot of people that come in the office have enough strength. It's not that that's the case. It's that it's those mechanoreceptors acting like a circuit breaker. They're kind of helping us find where the root cause of the problem is, so that we can get down and get it dealt with for you there and get it resolved. I also tell patients that they can just judge us here and see if that muscle strength comes back, because typically if it's more a peripheral problem, it's an issue that's going on with your muscles or your tendons, the ligaments, the joint capsule, joint synovium. We should be able to get almost 100% of that strength back immediately. And if we don't, then there's still some things we probably need to get treated. However, if it is a nerve problems where you might have, a herniated disc or a nerve that's getting impinged right where it's exiting out of the spine, could be just due to some inflammation that's going on, then we just want to see any kind of improvement that we can get, just to make sure that we are seeing it resolve for you over time. So over time, we'll see more and more of that coming back. If a person does have, like I say, a disc herniation or inflammation going on where the nerves are exiting. So how does this help patients here? It's going to help optimize their health and support, more long-term athletic careers and well-being, because the closer you have the proper mechanics, the better your body can operate, the less stress you're putting on your nervous system, so your body can focus on other things that it needs to do, especially your metabolism. Some people, when they're stressed, they're going to eat more. I mean, we can get into a whole bunch of stuff that way, but you're not going to want to perform your exercises. You're not going to be, wanting to do anything because your body's going to be achy and sore all the time. So the more we get the stress off of those joints, muscles, tendons, ligaments, and even the nerves, the better your body's going to be able to operate. So some other things are, some specialized treatments and technologies that we utilize with Elite Care. Some are just advanced spinal and extremity adjustments, because we're looking at trying to get your full body aligned where it should be at here, from your toes all the way up to your head and down to your fingertips again, because the closer we get those to the proper alignment, the less stress you're putting on your nervous system, the less stress you're putting on your body's kinetic chain, the mechanics of how your body works, and the better you're going to be able to, be able to reach your full potential. So not only are we going to help you finally feel good, we're going to help you finally reach your full potential. Some of the therapies that we use are like a class 4 laser. It's awesome at just treating, deep tissues and giving pain reduction. It does help regenerate nerves. It does helps regenerate nerves, and neovascularization also helps regrow blood vessels in the tissues that are affected as well. So areas where there might be scar tissue or arthritic changes where, you haven't had the problem fully dealt with in the past. We can get in there, break up some of that scar tissue, use something like the laser to help improve blood flow and get the nerve function back. We use it all the time with our patients that have neuropathy and have awesome results. People can see the results immediately after that first treatment when they have something like neuropathy going on. They'll go from having like blue toes to almost completely normal, pink colored skin. We could use therapies like focused shockwave, which is, again, just a tremendous help in clearing up any kind of musculoskeletal kind of itis. So like a tendonitis, bursitis, neuritis even kind of going on. It helps to decrease inflammation. It helps to regrow tissues, especially the connective tissues. I've seen patients, we've now had it over 2 years, probably going almost on about 3 years now. And I would have to say the patients where we've used this with, they're getting a better 3 to 5 times faster than what I've seen with any other therapies or modalities in the past. Another therapy, which I'd kind of compare this one, even with the focused shockwave therapy here, is our PEMF therapy. We've had this for 5-6 years. And it's awesome. I would say it's more a systemic treatment because it's helping to put a charge on your body's cells in your body. So it helps your cells function better because, it was originally invented and used for helping heal non-union fractures because your bones grow back together by what's called the piezoelectric effect. So if we put that charge on your bones and it can help them regrow, same thing happens with blood vessels. A piece of equipment that we had, or a PEMF that we had in the past called a beamer. It comes from Germany. They had some really interesting studies and we're even using microscopes to show just how blood flow improves in patients even within 15 minutes after having had the therapy there. We have patients that go on it all the time and they're achy and sore all over the place, and they'll get off and they're like, oh my goodness, I don't feel achy and sore anymore. They might have certain areas that still might be bothering, but a lot of it is gone. Other things that we can do are literally personalized functional rehabilitation programs. Again, when we do our initial assessments, we can use those and we get something often called a functional planar mapping, and we use that to help then develop functional rehabilitation programs for patients that are completely customized to them. So some stories, from some elite athletes and high performing individuals. We have patients that come in, they've had fractures, they've either had cast or, treated elsewhere, but we've utilized the PEMF therapy and their fractures are healing in less than half, even a third of the time, what they normally would, just because we're getting that charge put back onto the tissues there and the tissues are healing up. And then we're able to do, other soft tissue therapies there to help decrease the inflammation, get the scar tissue to lay down along the normal lines of stress instead of laying down like a big, keloid type scar. It's like we're getting that nice fine line in the tissue there so that it can actually function properly once everything's all healed up. These athletes, have gotten back then to their sports, like I say, in a half or a third of the time of what it would normally have taken. Should they have done more just conventional treatment, or in some of them, the case had a cast on and not been able to perform in their sports for months, and now it's down to weeks. Some athlete spotlight interviews here. We've had some athletes who have had, soft tissue injuries where there's especially like shoulder injuries in football players here. Some of them will have like stingers, and they literally will come into the office. They can't even really move their arm really well. Most times stingers are a short-term thing as far as that irritation that's occurring with the nerves, but a lot of them still have the lingering effects of some of that, where the muscles will be tight and restricted. We're going to be able to pick that up by doing some of our muscle testing. We're also going to be able to pick it up, using our functional movement screen with the markerless motion capture system. And, we can get down to just figuring out exactly what we need to do here, and, even be able to have ongoing tests to go back and see that, hey, yes, we're getting that proper function back, proper range of motion. And, these athletes can get back to doing what they want to be doing, being out on the field, on the court, on the rink, and back faster than what they probably ever thought possible. What is some of the scientific evidence, of the, effectiveness of elite care? I kind of was mentioning some of it here. There's, some of the studies here, I guess I've seen, like the study more with a laser there. It's helping to regrow those blood vessels so you get the proper blood flow going to the tissue, so you get the proper nutrients so the body can heal itself up. It's decreasing pain significantly. Most people are getting at least a 50%, if not about an 80% reduction on the first treatment. Pain can and will come back a bit after that, and that's why we need to do repeat treatments with it. Everybody heals, at a different pace, but we'll see that the laser can help speed that up again. Probably cutting the healing time in half, or possibly even in third for people. Also the research, especially like with the focused shockwave, that has shown that it actually helps stimulate your body's own stem cells to help regrow tissue. Same thing even with the laser. The focused shockwave, again, mostly with the connective tissues, collagen fibers and all that, but the laser with the nerves, helping heal those nerves up and regrow the nerves as well as blood vessels. Everybody in our office, if they're coming in and having some elite care done, are going to have a customized treatment plan done for them, because everybody's going to be different in what they have going on. And we're not just going to do cookie cutter treatments for people. They're going to get everything customized to what they have going on. So going through the whole initial assessment process there, we have a dozen different tests that we do put people through. So we're looking at things like balance, posture, range of motion, function, taking you through different functional movements here. Some of them might literally, some of our older athletes there, we might even be doing more risk of fall type assessments here to see how well their body's functioning and what might be the possible risk of them, falling and hurting themselves, should they, have a weakness or functional weakness. And that way we can address that with their treatment plan and, hopefully get it resolved for them, so that they get, better mobility, better stability, and less chance of, falling in, breaking a hip, falling in, hitting their head on something. But also in that initial assessment, there's thermography to even be able to see the areas where there's inflammation going on. We use a surface EMG to just measure how stressed the nerves and muscles are along the spine. If needed, we'll be taking x-rays to look at the, structural alignment of everything. And if something needs to be done, we will get that dealt with. We could pick up things like a short leg where we might need to use something like a heel lift. There's a foot scan looking at the biomechanics of your foot. And we're going to literally be able to determine, hey, do you need some kind of orthotic support? And those are custom prescriptions. So it's like you're getting custom prescription orthotics, not like the off-the-shelf ones that you can pick up at any store around, or even ones that say that they're customized. They're just picking something off the shelf to fit an arch type and, charging you quite a bit of money. Here you're going to get, custom prescription orthotics that are going to fit your feet, and they're, guaranteed. You got a whole year even to determine if they're going to work for you. Although most people know within the first 2 to 5 days, they're going to know how well they work for them, and they're probably going to know more when they're not wearing them because they're not getting that support that they actually need. And we also do tests to make sure that when you do get the orthotics, that they are giving you that proper support. So you're going to know for yourself that, yes, they are helping. Again, we're going to customize treatments. And again, we're going to use all these tests. We typically retest people on a monthly basis to make sure that they are making the progress that we're looking for as they go through care. If they're not, we're going to adjust their treatment program to make sure that we are getting to that goal. Someone might be, hey, they want to get back to a sport. Older patients might want to be able to mow their lawn, play with their grandkids, be able to go for a drive and not have, something be bothering them constantly as they're trying to perform their normal daily activities. So the long-term benefits of elite care here are just the sustained improvement just of your overall health and well-being. And being able to maintain that and sustain it over a long period of time, so that when you do have something come back, say you just slip and fall or, something happens, get back in again, because then it usually just takes a visit or two to get things back up to speed again. And you can kind of be on your way. Some people do choose to kind of follow through with, long-term ongoing wellness type visits. Everybody gets to choose what they want to do. And, we're here to support you in whatever you choose. Some people, hey, they just want to extend their athletic career. They want to be able to play, pickleball or golf, or, they want to be able to move up from, playing high school ball. They don't want to have an injury that they had in high school, and they want to be able to get into college, or they're looking at trying to get into professional sports. All of this is going to be helped out by making sure we get that proper mechanics back there, get that proper nerve connection going from your brain to your body, and also making sure we get that proper nutrients into your body so that your body can function correctly and heal itself. So another big thing is just that reduced risk of just chronic injuries. I know there's plenty of people out there that have, chronically sprained ankles or have chronic issues with shoulders or elbows or wrists because of injuries, whether it was sustained in a sport and now it's affecting other activities. If you get in, we can get those conditions, improved probably significantly for you. It's hard to say without you coming in and going through an initial evaluation, but after you go through that initial evaluation, we'll let you know exactly what we can do for you and, just what you can expect from treatment. Also, the big thing is just, the enhanced quality of life. Who doesn't, do you really want to walk around and always have to deal with that chronic pain and have to be using analgesic balms or something like that for the rest of your life? It's taking, ibuprofen like it's vitamin I. It's, these medications, even if you read the bottle, you're only really supposed to be taking them for maybe up to 2 weeks, and then you're supposed to consult a physician. Unfortunately, in traditional, medicine, they might just give you a stronger, ibuprofen or a stronger medication. Maybe it's time to just get a completely other view of what's going on here, taking a look at your body from a holistic perspective and see if there's things that can be done by just changing your diet, changing some of your lifestyle. Maybe it is you need to have some, functional physical medicine and rehabilitation done to help, restore your joints as close as possible to normal as you can get. And you might be just amazed at the results you can have. So I hope that gives you a little bit better idea of just how elite care, can help. In the next episodes coming up, we're going to be going over 3 different kind of patients that do show up in our office. Are rising stars, those younger athletes who are looking at trying to go from like a high, maybe a junior high to high school sports to college to professionals. We want to make sure that they're getting the appropriate care that they need to make sure that there's nothing holding them back so they can function at their full potential in, their sport or activity of choice. After that, we're going to get into, just the peak performance, type athletes here. And, those go from, high school age all the way up to, people in their 50s, 60s, 70s. If they're interested in just continuing to do what they love to do and not have, something holding them back, by coming in the office and just having that full holistic health assessment done, we're going to give you a pretty good idea of what needs to be done, and you can determine what you want to do to kind of move forward. And then we have the enduring athletes, those athletes that, hey, they just want to be active. It could be with a sport, could be golfing, pickleball, could be playing with the grandkids, could be ice fishing, could be, whatever sport or activity that they want to be able to do, but also maintaining just that good quality of life long term. So those will be some of the episodes coming up after this. So I hope that helps give you a little bit better idea of just how we could help you, in the office. If you do want to reach out, you can go to the website. We'll have some links in the podcast here, and you can check out the website there. You can easily even schedule appointments, or you can obviously call the office and we can get you set up to get you evaluated here. We even do have a $49 consultation with a rapid pain relief therapy with it. So if that's something that you want to come in, you can get a little sample of, maybe will help determine what therapy might work out best for you. That could be, laser therapy, could be some focused shockwave therapy, could be maybe you need some spinal decompression, maybe you need, the PEMF therapy, or something else. But you can schedule that appointment and we can sit down and talk and see what might be best for you. So that at least you can know, how some of this therapy could be of benefit. So, hope that helps. We'll see you again in the next episode.
Thanks for listening to the Extraordinary Health Podcast. For further information or to set up an appointment, go to the website at www.allseasonsintegrative.com or call us at 701-356-0016.